are proposing changes to the Social Health Act. While submitting their proposal to the Ministry of Health, leaders drawn from unions representing health workers claim that the 2.75% deduction for the new Social Health Insurance Fund is punitive. They also want fund members to go from mandatory health checkups and screening, as Elizabeth Atieno tells us.
Friday, healthcare professionals appeared before the Ministry of Health officials and the Social Health Authority to submit their proposals on the new health law, where they called for the amendment of Section 17 of the Act, which states that Kenyans will contribute 2.75% of their gross income to the Social Health Authority.
But we're saying that's already a taxed money. This issue where you are doing it is amounting to double taxation, it will still be arising to a court case. So please avoid it. If you avoid it, consider it to be based on the basic salary.
We know that the other insurance, the NHIF had regulations had 90 days, yet they were still not complying to that. So it should come out. How long is it? Well, our proposal is 30 days, that within 30 days, the services have been provided, given that now we are embracing technology.
They also want answers on the criteria to be used to identify low and high income households.
You are asked how much you earn. First thing you do is to cut your salary by half and start digging from there. So we do not want that. So you're saying the best way is to evaluate you as a person. How do you live? After on Friday evening, where do you go?
Public health specialists want the Social Health Act to make it mandatory for Kenyans to go for health checkups and screening in order to curb the spread of non-communicable diseases like cancer.
If we had public health labs, we could have saved those kids, but they are dying. We are dying of preventable diseases because we are not investing in the right places as a country.
Some unionists, like nurses, clinicians, and nutritionists, have differed with Section 41 and 58 of the Act, saying they lack representation in the Social Health Authority.
As much as the benefits package may be prescribed by the CS in consultation with the board, but it should also include the other stakeholders as well.
Some stakeholders have proposed amendments in the Digital Health Act, especially the provision that makes it mandatory for 7-year-old children to register their biometrics, saying this poses a potential threat to data privacy.
But when we are going to do telemedicine, how will the women who do not have access, illiterate, unless we are explained very well?
The health unionists also want the 72-hour pre-authorization time revised to 24 hours. On Monday next week, the Ministry of Health and members of the Social Health Authority will lead a public participation forum in Makueni County. Elizabeth Atieno, TV 47, Nairobi.
Well,